Oh, hello. I guess that's working. Okay. Hello, everybody. Thank you all for being here. This is our fifth, I think, fifth, I think, meeting for the comprehensive plan. So we're talking today about public health. We're very grateful to have with us a wonderful facilitator and a panel of experts today. I wanted just to say thank you to everybody who's able to be here, and thank you for Jose for being our live tech person. And thanks to everyone in the audience for listening in and providing your information. Once this is all finished, there's going to be plenty of opportunity for people to provide more feedback and so on. I did want to just say to introduce, we've got Christy Farquhar. She is the executive director of the Smithville Community Clinic. She is one of our stakeholders that represents the community on our comprehensive plan program. And so the stakeholders group meets several times. They've met 3 times already. They'll meet at least one more time, possibly a 5th time. We have to talk to Langford and figure out their timeline, but something like that. They're sounding boards in the community. And so if you did have any questions to talk to our stakeholders, that's part of what they're here for, is to talk to people. So she is facilitating tonight. And thank you very much, Christy, for doing that. We've also got Donna Nichols, who is our new executive director of the Bastrop County Public Health Department, which is very exciting. We've got Norma Mercado, and she's the executive director of Bastrop County Cares. And we have Philip Marquette, who is with the Texas Public Safety Training Academy. And I'm going to let you all just say a little bit about yourselves to introduce a little bit more than just your name and location. So thank you very much, Christy, if you want to start.
I am Christy, the Executive Director of Smithville Community Clinic for the past year and a half. I am excited to be here today, and I thank you all for coming, and thank you, Jill, for having me. We're going to learn a lot and hear a lot of opinions and knowledge spread through the room tonight, and I'm excited to hear that. Donna?
Hi there, everybody. I'm Donna Nichols, and I think this thing is on. I guess I need to get it a little closer to my mouth. Okay. So I've actually lived in the Smithville area for about 25 years before I moved up into the Cedar Creek, a little further upstream. Very excited for what you're doing here in Smithville and an opportunity to talk about public health, my favorite topic. Just to tell you a little bit about myself, probably about 45 plus years of a public health career, largely at state and federal level, across multiple communities, multiple states, and now find myself in my home county doing public health. So I'm very happy to be here. Thank you, Jill. Thank you, Christy.
We're happy to have you. Thank you. Norma?
Yes, good evening, everyone. I am Executive Director of Bastrop County Cares. I've been in my role for about 13 months. And but before that, I worked in school systems for 24 years. I'm a social worker, so I worked in the Del Valle and Bastrop area. And most of my work was really in the community, doing home visits, helping people navigate the different challenges and barriers for those experiencing homelessness, foster care, military connected, teen pregnancies. So I know the community from the ground. Like I've seen the challenges. I was facing the barriers with them. And that's what I was inspired to apply for this role, because I often saw that the funding was never getting to the needs that I was seeing. So I really appreciate this position that really allows me to advocate for those needs and partner with our local school districts to continue to serve our students and families in the community. I've been, most of my area that I've been working is rural communities. Before coming here, I lived in California. I grew up as a migrant child. So that's all I know. It's rural community. Farming, growing things. So I'm really passionate about rural communities and really providing the resources and that the communities need. Thank you.
Thank you, Norma.
Hello, my name is Philip Marquette, and mine died right as I.
Oh, here.
Yeah, I think it's just bad on bad. It just died again.
Oh.
Magic
You
touch.
just want me to kill a microphone?
Yeah.
Pass one down.
Christy, try Christy.
Just talk loud if you want. All right, there we go. Now you can hear me. So my name is Philip Marquette. I am the Assistant Chief for Texas Public Safety Training Academy. We are a 501c3 nonprofit school here in Bastrop. The school started in 2018 here locally on Main Street in Bastrop, and it's grown to Industrial Boulevard, and we're rapidly outgrowing that location as well. We specialize in killing microphones.
Good job.
We specialize in training first responders in EMS, fire, and security. I myself, I'm a Smithville-born resident, born and raised here, graduated high school from here. I'm a licensed paramedic along with a dual board certified critical care and flight paramedic as well. And I have a great passion for community health and affecting change in a local community. So that's what brings me here. Thank you.
Thank you, Philip. Thank you so much. So what we'd like to do is open the floor up with the question of what issues, opportunities do you see for public health in Smithville? So we're going to open the floor up for a few minutes and just get some feedback and input on that. So who'd like to share with us?
And please do speak in the microphone, and hopefully they won't die while you're speaking into them. I'm going to try to, if you can.
Any ideas? Anybody have some input? Don't be shy. Go Janice Bruno.
So I think, after, I was with the clinic for 10 years, but one of the things that we've seen probably within the last 20 years within the community, Bastrop County, and I was talking to the city manager in Bastrop the other day about the drugs issue and suicide. So we know we've got a huge drug issue within the county, okay? And we also know that we've had many, many suicides. And I know that they're hosting Monday night meetings for suicide awareness, but I think we need to do more. So I just thought I'd bring up those two topics, and I can see those as opportunities for public health.
Good input, Janice. So to follow that, would you have any ideas like to do more? Do you have any spurred thoughts on that?
I know down in, so for example, Smithville right now is hosting the suicide awareness on Monday nights. And that was great. It's being funded through the Born Again Emporium. Okay, this is one municipality within Bastrop County. So we have several municipalities within the county. I know down in Lockhart, they also are running these types of meetings. So I think for the region, and then my question is, who even has the statistics on what the suicides have been or are? We know who these folks are. Who's got the data? Where's the data? Okay. Where do we really need to target? Just like 3 days ago, we had a young man, he's 32 years old. He was contemplating suicide. Okay. It's a friend of a friend. Where do you go? I said, well, the first place I know to go is the Smithville Community Clinic. I can pick up the phone. I probably can get a counselor on the phone, and we can do a Zoom call. Okay, so folks have to know that the resources are there to get help. But this is just, now I want to broaden out, okay, not just Smithville. Where do we go in Bastrop? Where do we go in Elgin? So be thinking about, taking the same model that we're using right now in Smithville and move it around to the various communities.
Thank you, Janice.
Time's up.
Let me pose that to everybody else as well. Anybody else have any input on what issues and opportunities you see for public health in Smithville?
Oh, well, I was going to say the same thing about mental health and some peer support groups, group therapy as opposed to individualized therapy. I think it's more effective that way. Because if I'm the moderator of a group, I can't say certain things because I'm a professional, but the group can say something to each other, and then the moderator has to kind of be able to control the comments they're saying to a certain degree so that yeah. So it's not more damaging.
Mhm.
I think social media is a big influencer in the bullying and suicide. I don't know about teen pregnancy. If that's a problem here. Teen pregnancy, I don't know if that's a problem here or not. It's a problem in lots of places.
Could you weigh in on that, Norma, on teen pregnancies?
I don't know. So mental health is like my I love to talk about mental health. It is something that we're really trying to address in the county through our mobile unit, partnering with other organizations and our mental health with Blue Bonnet Trails, with the Mental Health Authority. But I think just based on what you're hearing is definitely a big concern. We do know that suicide is the leading cause of death for children and youth right now. That is something that we need to prioritize as a community to addressing. The issue that some of the challenges that I've seen is that we don't do enough preventative outreach. So something that we're doing is partnering with, we just had our staff trained on how to teach parents how to help their children regulate. Because sometimes what happens is that we wait too long. We don't realize or don't see the signs, and we wait until it's too late. Or sometimes parents don't know if their child is saying, I want to kill myself. We say, oh, you're going to be okay. And we don't take those things serious. And so I also volunteer for the Bastrop Sheriff's Victim Services. So I've had to take some of those suicide calls, and when you're talking to the family, you always hear about all the signs that were there, but we just didn't know what to do. So I think we really need to do a better job at increasing education about mental health, normalizing mental health. There's still a lot of stigma, especially in males. And so normalizing, that it's okay to not be okay and it's okay to get help, especially after COVID, which is one of the reasons I stepped away from schools is because I was experiencing burnout. All I was doing is putting out fires, crisis after crisis after crisis. So I can certainly sympathize to what you're seeing. And I think there's definitely a lot of things we can do in community. For teen pregnancy, I didn't see a lot, like it wasn't not like a crisis or anything, but definitely I know the topic of sex education in schools continues to be something that parents keep bringing up. So that's definitely something that we could do better is just increasing education in schools. I was a teen mom at 16 and my mom, we don't talk about those things, so I think it's just sometimes depending on your culture, you just don't talk about it. But then everybody gets upset when you get pregnant. You're like, well, I didn't even know, So it's like education is super important, but I think schools do really well with providing services to students who are pregnant here.
Take this one.
I can. Okay. So I want to echo a couple of things that I've heard. Janice, of course, around suicide specifically, the RWHC has taken on suicide awareness and prevention as one of our initiatives for 2025 under the bucket of mental health awareness. And so we're working with, super happy to be working with Mark Anthony. We're putting together, he's going to be hosting a gala in April, really centered around this. Super excited about that. But to Norma's point, and then also to Caroline and to Janice's point, I think that we are doing some things here in Smithfield that are great. But one of the models, I know that Norma and I have worked on this pretty intimately, is peer support groups. This really does work. And it's not the answer, but is an answer. And so to Janice's point, we need to get bigger, we need to go further. But, perhaps Smithfield takes the lead on this. I think that we are well suited in many respects. I mean, we take the lead on a lot of things. We do lots of things for such a small area, I think. And maybe it is an initiative that we take on really there is a lot of data and a lot of that supports peer-to-peer. And to Norma's point, just talking about it, saying the words, Dr. Davis, Charlene's not here, but you were there at the meeting. And one of the things that wasn't a surprise to me, but that it was just good to hear was that the first line of defense is just asking someone if you exhibit, if you think they're not even exhibiting, like what does exhibit mean, right? To Norma's point, right? I saw the signs, but I didn't know. If you just, we all have this embodied knowledge when we're with people. And if you don't, then please practice this. It's part of it's empathy. But, just checking in on somebody. Hey, are you okay? Looking at them in their eyes and saying, hey, are you okay? And if they start to fiddle faddle, is suicidal ideation something that you're considering, right? Like, I think it's really hard for us to pose those words because I think they don't sit well in our mouths, to Norma's point. But that is the most effective and the number one line of defense, Dr. Brown says, right? Or Davis. Brown, Davis, I always get it wrong. We'll say both names. So to that, I'm super interested as a researcher, as a person who did some research on peer-to-peer. We talked about this with MHM when they came to our visit, developing a stronger peer-to-peer support group, a model. There are models out there. We don't have to recreate the wheel, but I think there could be we could be positioned to maybe train, like this would be training. So this is kind of Janice, this is kind of the community clinic, right? But training peers to advocate for each other. And maybe that's where we start. And then we have a Smithville model and we apply that elsewhere, just, out loud.
So we are running against our clock. If we're about 5 minutes, running about 5 minutes behind, if you want to take another suggestion and then move on to the next part for the discussion with the panel.
I think across the board, thank you. I think across the board, we all agree, yes, groups are amazing. We're seeing that what the suicide support group are doing, but removing the stigma and removing the fear that we find, which is what you said, it's a bad taste in our mouth to say, are you considering suicide? That is very difficult. We deal with this daily in our behavioral health, not daily, but often in our behavioral health department, but removing that fear and educating people on red flags to where you do address them. Donna wanted to share something.
Thank you. All of you know that the Bastrop County Public Health Department has been in existence for a year. And within that span of time, we did 10 community discussion groups that touched about 115 individuals in the county. What we learned was every time we did a discussion group, two things would automatically appear from our discussants. One was access to care, both navigation and coordination. And the second one was mental health. And then we started talking about other preventive measures beyond that. But what I wanted to say about the mental health piece is public health is a partner to mental health. Public health
See if the batteries are any better at the.
Sorry, they had a meeting last night that lasted very long, I guess.
Okay. All right, here we go. It must have been a heck of a city council meeting. So when the mental health piece came up, I sort of flagged it in my own mind about what can public health do to support mental health in this county. And I had an opportunity to go to a national level meeting hosted by the National Association of City County Health Officials. That association supports all 3,300 local health departments in the country. And they provide certain services and programs to its member organizations. One particular program that I find particularly helpful as we start talking about how do we engage so that our entire population thrives? And how do we recognize that all of us at one time or another need support? Out of that conversation that was being held with, I don't know, 3,400 individuals there at that meeting, one program that became very evident because of the evidence base that it was created on is a program called Credible Mind. Credible Mind, I've been approached by one of the founders of that program to think about standing that program up. It's a technology-based program. It's no cost. It will allow anyone to go through and take an assessment on their particular situation, and then be able to move from that assessment to a potential need for diagnosis and treatment. My role with the health department is to act as a resource, again, to our mental health professionals, because our mental health professionals have their own health authority, as does public health. We are in the game together. And if we can provide a resource that will support all the better. And I would invite you through Norma and others that are engaging with this to a meeting on the 22nd. The more the merrier, right, Norma? We're going to actually look at the technology, talk about whether it fits for what we want to do. It will be a decision made by our colleagues together, and could be hosted by the public health department. But I do want all of you to take a look at it. It is an evidence-based program. It is supported nationally. The founder of that program will actually be in College Station in February if you want to go to the Texas Association of City County Health Officials. So I did want to say that there is something on the horizon that we could possibly relate to. And I'll just stop there.
Good to know.
Yeah.
No, thank you for sharing that, Donna. So with that, we're going to move on to our fireside chat with our panel of experts. The first question we have for you is, considering preventative health priorities, what are the department's main preventative health initiatives, and how are you promoting these within the community? Would you like to start? You betcha.
I have to say, I had a really good day today. Some of you, all of us have those days where we're just worn out and, want to go home and sleep or do something else that's not as positive, maybe. Anyway, today was really a good day, almost perfect, in fact. After a year's time, this health department, with the help of a task force that we've been working with, has been able to actually hire staff. And so today I recognized a couple of new hires and some new students. One of the staff happens to be an epidemiologist. Yes. An epidemiologist in regular terms is a disease detective. Yes. That individual will have access to the National Electronic Disease Surveillance System. Okay? That individual will also have access to any reported diseases that are reported here in this county. That information will start to come back to us. Yes. That individual will also interface with a lot of our physicians, our hospitals, our clinics, et cetera, to help us understand what is occurring in the county. Just to let you know, we got our first report the other day of a confirmed case of hepatitis A. And so that particular documentation is about ready to open up in a big way. And our first hire is an epidemiologist. His name is Andrew Lamb. Andrew will have his DRPH, Dr. Jones, from our Texas A&M University in a matter of about a year. And so we're thrilled to have Andrew Lamb. Another new hire is Adriana Rodriguez. Adriana Rodriguez is our information specialist. She speaks and writes Spanish very fluently. If you have been around any of our sessions that we've done, Adriana is that lovely young woman who wears glasses that are in the shape of hearts. So big personality in a tiny, tiny little body. She too, in a matter of about 4 months, will be Dr. Rodriguez. The other folks that have come on board for us is another young woman, again, from the Aggie Express, as I like to call them, is a young woman by the name of Ruby Hernandez. And Ruby will be doing environmental health for us. She will specifically do air and water sampling. And so that will give us a dimension that we've not had before, and that will give us an understanding of what's going on around us that the environment influences. Another person that we've just announced too is someone who lives in the city of Bastrop, and that is Amy Mills. Amy Mills is a student at Tulane University. I take them however they come to me. Amy Mills. Amy is the former CEO of Emancipet in Austin. Amy had about 18 years, and her story is something like this. You know, folks were turning in their pets, and I realized it wasn't about their pets as much as it was they couldn't afford to keep them or to keep them near them or within the home. And so she realized at that point, she really was starting to speak the public health language. And she decided after 18 years to go back to school to get her degree in community health science at Tulane. So y'all, today was a great day for public health in this county. And so with the help of many people, we've been able to move the needle pretty quickly for us in the world of public health. And we want to be of support to all of you in terms of providing the data that we can get to you, to share in some of the programming, to talk about how do we do this better together. And I'll stop right there. I could talk for a long, long time. It's Norma.
Same question. Yeah. So super excited to hear all the stuff. So for Bastrop County Cares, we're super excited too. We've had a great day, great week, great year. We were granted $1 million through St. David. So we're currently working on the beauty about this grant is really to address the social determinants of health or non-medical drivers of health. And so the goal is to re-grant 75% of this funding back into community based on innovative solution, community driven. So it's like the change agents to the next level. So if you have something, a project that you feel you need funding for, please be on the lookout. We will be releasing. We're trying to make it super easy. We understand that not everybody can write grants, do fancy presentation, submission application. So we want to make it really easy. You can do an application. You can come and present to us. You can send us a video recording. We just want to know what is the goal, what is going to happen if you do your project, and help you do it and see because we believe that the solutions are in the community. The problems to those solutions are here. And so sometimes people just need support and funding to make it happen. So that is a big initiative that we have coming up. I'm working on the release of the grant proposal and things like that. So just keep an eye on our Facebook, follow us. We're also focused on the rural underserved community. So not too much in the cities. Last year, we were trying to be present, get to know who we are, but really our focus is in the rural community. So those neighborhoods, parks that typically have underserved communities and bring programming and resources. One of the biggest calls that we get in our call center is food and housing. Those are the two number ones. We're trying to figure out how can we partner with some of the local pantries that we can get food boxes to deliver to families because transportation is a barrier. So how can we remove those barriers? And that is our goal. We're also launching our new collaborative model, which is focused on the social determinants of health with 4 different collaboratives: health, economic stability, thriving communities, and education. Thank you. And so we're trying to build them. So if you want to be part of it, we need volunteers. We want to hear from lived experience, from the people that live in those neighborhood, in those communities, to be the voices. And then together, working with our public health department, the Smithville, our goal is not to compete, but really support each other. I think if we combine our efforts, we can leverage the funding and address the issues that we're having. So we're really excited. And so just keep an eye. Again, follow us on Facebook.
All right, so my department doesn't have any direct effect on the public health in this county other than the ones who we educate, but I have predominantly been invited here to kind of speak on the pre-hospital side of health and what we experience. So I'm just going to give you guys some general updates that are going in the county. I can't speak on anyone's behalf, so when I do bring up ESD3 here in just a moment, I am not a member or anything like that. I'm just speaking as an informed citizen, more or less. So in the county on the pre-hospital side, meaning once you call 911 and you're not in a hospital or a clinic setting, we have voted and it has been approved for ESD3, the tax district, that will stand up our own ambulance services. The board has been appointed. And there is now 5 board members. They have also appointed their positions, and they're actively working towards the budget and how they're going to stand up initial plans. Acadian's contract is set to expire May of 2025. They are going to be speaking with the contract and see what they can work out and how they plan to move forward. But some big changes are happening in the county for pre-hospital care, and I'm looking forward to what they're going to do.
Awesome. Thank you so much. Okay, next question is on promoting healthy behaviors. How does your department promote healthy behaviors to prevent chronic illness and other health conditions? You want to speak to
Yeah.
that, Norma?
Yes, I'd love to speak on that. So one of our biggest initiatives is our mobile unit with their recreational programming. Our goal is to get people more active, children more active, families more active. Something that we heard from some of the communities that we've been is that when we're there, they feel safe to come to the park. And so we know that when there, we're providing recreational opportunities. We have kids moving. So our goal is to continue to partner with other organizations. And if you're here from an organization and want to join us, please, we're starting March through October. And so our goal is to bring, keep kids active, families active, and then also providing educational opportunities on how to eat healthier, how to make healthier choices, things like planting your own fruits and vegetables, or how to cook better and healthy. Sometimes you can't make you can only stretch your dollar so much, but you can make, for example, I didn't know that there was a difference from brown rice to white rice. And so like learning those little things, and sometimes, so that's our goal, that's how we promote it. And then kids moving and exercising, and then discovering that sometimes sports can also get you to college, and how do we motivate them? So that is a way that we're trying to do that. And then we also have on staff community health workers who kind of help navigate families, applications, getting to a medical appointment. We have some community health workers that even transport some of our elderly people to their appointment. So it's kind of how we're doing it. We're very unique in that really the program is shaped based on the need that we're seeing. Yep.
Thank you. Thank you.
Yeah, sure. So once we went through this qualitative study with 115 people in this county and trying to define what our priorities were out of all of that, those 4 priorities were access to care, environmental health, infectious disease, and chronic disease, health promotion, and education. With that, this pretty tall order when you think about chronic disease and what we can do about health promotion and education as a means of preventing or at least deterring diabetes, heart disease, cancer, and realizing that there is a lot of preventive opportunities in all of that. First through, obviously, was breast cancer that the community engaged in, but we also realize that there are other cancers that we can do something about. And so this is a commercial for what's to come, but we will have an opportunity to put out information countywide about the behaviors that we can do something about and how to connect those to the resources, especially through access to care, et cetera. My background is in health promotion and education, and I realized that we have to start there first as a means to get going. But we have a tremendous problem in diabetes. We have a tremendous problem in cancer and heart disease. And so there will be opportunities for this new group of exceptional young, bright people to really move the needle forward on those issues.
Thank you, Donna. Would you like to speak to that?
I don't think I can add too much to it. I'd like to echo everything they said. Really, pre-hospitally, what we advise people, especially in chronic disease, is trying to help coach them about daily care of it, making sure that you stay on top of your medications when you're supposed to take your medications, and then life activity. And I know that can be overwhelming to change their life, but it can't be stressed enough to become more active, even if it's just 30 minutes a day walking or a set of stairs. You don't have to go out and join a gym or join a fitness group. Just get up and get active any way you can. Any way that raises your heart rate is beneficial. Believe it or not, it feels like nothing, but it is truly making a difference. And then don't forget to drink water.
And sometimes the key is just letting people know that there are things that don't require a gym membership, right? So,
Absolutely.
yeah, good job. So we'll just keep going with you, Philip. Yeah.
Sure.
Preventing health crisis. We're going to ask this one, and then we're going to go to the public discussion. What measures are in place to prevent future health crisis in our community, and how do you communicate these preventative actions to the public?
Sure. Again, speaking from the lens of a pre-hospital focus here, I think the biggest health crisis that we face is underinsured or state insured or indigent care, where people are relying predominantly on the 911 system as their primary care. As much as 911 is there and they are there for you, they can't provide the continuity of care that you need from a PCP. There's not enough family medicine doctors anymore, unfortunately. That's a crisis in all of its own. But with the development of the new health department and some other collaborative initiatives in the county, I'm sure we're going to move forward with bringing care to people. I mean, there's already great leaps and bounds from the community clinic to the development of the Rural Whole Health Coalition. I really think it's going to start to make a difference in people's lives, basically bringing to the care to them and where they need it. So there's some good initiatives coming down the pipe, and I think it's going to make a difference here in the next few years.
I've got one. Yeah, go Norm.
Okay. I was going to say, so for us is, again, with our community health workers is really helping families apply for benefits, because we had a community conversation in the Cedar Creek area and heard from a lot of families there that we mapped where they go to the doctor, and I was surprised, a lot of them don't go to the primary care, they just go to the ER.
Exactly.
And it's really sad because they just don't have health insurance. They don't know where to go. And so that is something we want to focus in, is getting people connected to overcoming the huge Medicaid application challenges. We have a lot of families that say, I applied and I keep getting rejected. And so we're really trying to help them navigate that system. And then kind of trying to stay ahead of the broadband. We know that broadband's coming. There's a lot of money for that. But with that, there's also a lot of challenges, because not everybody knows how to use the internet, how to navigate the internet, the dangers of the internet. But also that we'll be able to teach our clients how to use the telehealth, how to see their, be able to access Medicare through telehealth. And so that's also something that we're trying to focus is on those digital literacy classes to prepare the community for what's coming.
Okay, Smithville, I've got something for you here. So If you really want to see the video, go to Ferris, the little town of Ferris, Ferris. Look at their city, and the video on One Tap. I have I don't know how this happens, but this individual approached me back about a year ago who said, you know, I've got this technology program with a smartphone, and I really need your help to help me write a grant to South Carolina, because I think we can set up a technology program using its smartphone that will get to providers who can give you a prescription and then link you back to a provider in your community. I was like, what? So as we talked, it was like, I'm going to file this away for future reference. He calls me back about 6 months later. Hey, I got the grant. Can I do something for you? And I said, bingo. Why don't we talk about how we can do this in the county of Bastrop and pick a pilot site where we can do this? Here's the uniqueness of this. The way it's funded, through the water bill. Through the water bill. In the town of Ferris, they were able to give every person access to a panel of providers who could write prescriptions, do basic healthcare work over the phone, and then direct folks back. And they could do that for a residence with as many as 10 people for as many times as they needed it through the month. And that there was a single charge on the water bill. The whole city. The whole city. Now, I know your next question is going to be, how much was that?
How much was the water bill?
How much did they add to the water bill? Somewhere between $7 and $10 a month. Whoa. Now, how does this happen? By the grace of God. Actually, the way this gentleman conceived this idea, and it's quite the story, but the short version is he's an ER physician. He got really tired of seeing folks in his ER that didn't need to be there for the sore throats, the stomach aches, et cetera, et cetera. He also worked during COVID and realized all the ups and downs and arounds that was going on around COVID, made a little extra money during COVID, and said, how do I use this money to contribute back to public health? And so, brilliant young man who actually just received an award from CMS for an innovation award on technology. This is a person that wants to be a part of Bastrop County and bring the technology here. That's unbelievable. Would love to talk to y'all more about that. We've approached the town of Elgin about this particular innovation. Smithville, you might have an interest in sort of looking at what is there. But I can tell you the wave of the future is technology, and that we can do some things that we've never really done before to help our folks. So.
We can. I'm doing it wrong. Thanks, Caroline. Maybe this is offline, but $7 to $10 per person through the water bill, and then
Per residence.
per residence. Sorry. Thank you for that. And then you said 10 people per month
As many as 10 in the household.
in the household, but across the whole city.
Correct.
Okay. Go, Janice.
So, no, this is, like something's wrong in the city and you go to See, Click, Fix. Hey, I need this limb trimmed. I need this. It's almost like the same thing, but you're getting yourself fixed. You're getting, hey, that physician gets connected with you. So we do see click fix for all sorts of stuff in the city. So it's a see click fix for the body and the mind and the soul. So I love this. I just looked up Ferris.
Yeah.
And I'm not sure
Check
how
out
big a town it is, but we're
It's
about,
just north of Dallas.
yeah, about 4,500. I mean, almost the same size as Smithville. So brilliant.
It is brilliant. I'm an entrepreneur at heart, y'all.
There would be a interesting question to be had there is whether or not it has mental health services and whether it can manage initial crisis and then move you on to a local provider.
Actually, that has been entertained by Hayes County, in fact.
Okay, so we are going to, thank you all. Thank you all very much. Excellent information, much appreciated. So we're going to go to the public discussion. We're going to give about 25 minutes still, okay? You're going to get together, discuss amongst your, amongst yourselves at your tables, the topics, and help me out here, Jill.
Sure. So around the room, you'll see big papers, sort of talking about the different topics that we had on your tables. There is a survey that we had sent out. What you'll see around, I've got the big paper here. I'll close the door so you can see what we're talking about. Those are the main topic areas. You can talk about whatever you like to, but what we'd like to have is capture your ideas and your questions and anything that you might have connected to those topics. And then when you talk about it among your table, and then write down what your table and you as an individual would think are most important, and then put that up on these topic areas, and so that we can capture that. So the first step is you all just kind of talk in your tables and figure those things out, write it down in sticky notes and put it up on these boards. The second thing is going to be, you'll come back and you'll report back what your table said or some of the top issues. And then the last thing with that series will be, I will be passing out these dots and you'll go around the room. So this is the interactive part. You'll go around the room and you'll start to put priorities on the different areas, the different ideas that are posted on the boards. And then the last thing that we'll do is we'll come back.
And you could pick a spokesperson from your table and you'll report to the group your opinions and your thoughts on that.
Right, and
Did that
then
help?
the panelists will wrap that up with final thoughts about some of the priorities that came up to the top and some of the ideas that they saw that they thought could have traction here. So that's what we're up to now. Thank you all very much, and please stick around.
Been able to- She's really, really. I do too. I do too.
Okay, if it's about 7:15, we've got about 15 minutes left to the meeting, the official meeting. So if you don't mind, if you have your ideas and you can start posting them around, and then, or maybe before, well, either way, if you want your table to start talking about your ideas before you post your ideas around, that's fine too. If you need to look at your notes. Okay. Yeah, if you want, how about if we do that? But I did want to take the time out to just, since we are talking about health, Smithville is going through the It's Time Texas Community Challenge. We've won the community challenge for for 7 times in a row. This will be the 8th year. I've got some information and my printer is being persnickety, and so I'll try to get more of these printed out for you. But if you haven't already signed up, I've got also my printer hasn't printed, but I've got QR codes so that you can sign up. Makes it real easy. Talk to Jose or me and we can get you connected. But I'm going to call this a registration event because we got 10 people, so 100%. Okay, thank you all very much.
Hello, hello. I'll let you. So, are we good to start, Jill? I guess. Okay. So one of the things that we were discussing here, it's childcare. It remains one of the top priorities in the region, especially for workforce and uh, growth overall. There's a lot of talk about bringing people in, building more houses and all that. But one of the biggest challenges that we still face in the area is who gonna take care of the children of the people that we want to employ. And one of the things that I've been trying to do more research and I found other countries have navigated in a different way is combining seniors with children. Utilizing the same space to have the similar necessities, similar needs, and the kind of cut in half the overhead of insurances and other needs for infrastructure, and then bring professionals that can combine these two different populations that have very similar needs, and make it sustainable for the community. And that's something that we're actually trying to explore. But personally, I haven't cracked the part for the details about how to get the licenses and all those specific details for Texas for the people that will be working with the children. Seniors are a little bit easier from that side, but the children part has a lot of red tape and a lot of certifications and stuff for good measure, but it makes it a little harder to find a way to implement and combine them both. So we were talking about that and see how we could do something with that in our community because of the huge need. Every time we ask the community what things we will need in order for support growth, especially families that would like to go to school, but they can't. They work throughout the day and at night. They have nobody to leave the children with. So that's definitely something we talked about. Leave Janice.
Yeah, this could be done throughout the region. And just something I thought about is childcare. We can get a certified nurse assistant qualified in 6 weeks. That's how fast we can run those guys through as far as training goes for Regency Towers. I mean, that's how long the class is. So we could have certified childcare assistants and run them through some sort of a program. So they're CCAs, not CNAs, and figure out a way that when they leave the training, they're going to get the prevailing wage, which right now is $18 an hour. And see, in most of these childcare places, they're getting away with paying them $12 to $15 an hour. But no, set the standard. And the other thing we talked about, this is specifically for Smithville. Last night, we talked about a public improvement district here and part of that bond money and what it can be used for when you bring in housing. And so last night they talked about, oh, you could improve the roads or the sidewalks, or you could put some parks. But like Joanne and I were talking, when she had kids in Houston at that apartment complex, they had the child care center. So part of the PID bond funds, and I wish one of the city council members were still here, you could use some of that funding. It's going to help the developer, but it's going to also help the community because we'll already have a built-in daycare center. So anyway, that's all we were talking about. Did you have some?
No.
Well, we talked about a whole bunch of things. We talked about, I'm not in any particular order. Insurances, how the process is very complicated, it's very confusing. People don't want to deal with it. That's why they go to the emergency room rather than having a primary care person. Plus, there's fewer and fewer of them. Why do you have to have special insurance for your eyes and your teeth? Because these practitioners can pick up on diseases in the early stages to start treating them and make lifestyle changes faster than the general care physician can see them. Talked about women's health and men's health, pap smears, mammograms, prostate health, all that kind of stuff. Talked about nutrition, processed foods. We haven't, the standard American diet promotes sick care rather than preventive health care with processed foods and chemicals. Like just this morning, they stopped the red dye. And I think yellow dye is also in their works or out of the works. We talked about elder care. They're lonely. They're having need respite care because they may be caring for a sick spouse. Talked about a little bit about teen pregnancy and needing the child care portion of it. Talked about preventive measures versus sick measures. Talked about extended family versus the nuclear family. Having when we used to have multi-generations in one family, the grandparents can help to discipline the younger children, which, because mom and dad are out working, you've got some built-in babysitters, but also they can help with raising the children and giving them good morals to live by and discipline them as needed. We talked about prevention, just overall healthcare prevention for wellness as opposed to treating emergencies. Anything else, Jill?
I'll just add some things. We need to have a community of just a wellness day. I've worked for the Internal Revenue for the last 42 years. And for people that don't know how to do the tax returns, we have people that will do your returns for you. You just have to show up. We do it for free. Why couldn't we do something for our community? I know so many people and they're elderly that are sick. I've watched them go from healthy to sick. They're obviously something really seriously, but because of lack of insurance, but lack of knowledge, afraid they're going to have cancer, don't want to know they have cancer, trying to encourage them that they would come if there was like a free wellness clinic that I can show up and I don't have to worry about how much is this going to cost me. At least get the diagnosis. They may not go through with the diagnosis, but at least they know what they have as far as doing that. But a lot of people don't make that effort because they don't have the money. And ER, when you go to ER, you have to treat them. $5 a month, maybe they pay for the rest of their life to get through that bill. But it's an opportunity. That's why they don't go see, and you can't even see a physician anymore unless it's like 3 or 4 months out. So if you're sick, we need to offer that to our opportunities for people who need that.
Well, yeah. We're a free clinic.
Do y'all do wellness?
Well, women's, we now even added another day.
I finally got her to come here. But all she had to do is go back for the blood test. Can't get her to go back for the blood test.
We have help. No, we have help with that too. So have her call and talk to either Catherine or I because we have a sponsorship for blood work. If she needs it,
Mainly women's health.
women's, and I'm not doing a public announcement here, sorry, but I need to get this out because people need to know this is super important. So our women's now, our board graciously has allowed us now to pay all but $10 of all their test fees. So when they come in for their checkup, it's free for them to come in, cost them $10. They don't have to come and get a free exam and then spend $50 or $75. So please send them our way. pap smears, their exams. They're going to educate them on breast care, the breast cancer and anything that they ask that has to do with the female things that we need. And they will talk to him. We have an NP that's been in, our new one has been in OBGYN for over 10 years, and she comes and helps us out one day a month. And then the first Friday of every month, we still have a half a day that we do with Barbara Howard, who's been serving us for a long time and helping ladies here. Please send them to us. I'm sorry? Kayla Smith. Kayla Smith. Yes, they do the testing for that as well. And then Barbara Howard still comes too.
Is that the same nurse practitioner?
I'm sorry?
Do you know if the nurse practitioner, what office she practices, what doctor?
Now she's with Siegel here. She works here with her. She can, yes, yes. And so she comes to our clinic for a full clinic, and she does it in the evening for those that can't come during the day. She does it in the evening. Send them our way. We're there to help them. We don't do the vaccination, but we need to look into that. We need to look into that. Norma, I'm going to come to Would y'all like to share? Thank y'all for that opportunity.
No, okay, all right. It seems like I'm not gonna necessarily, I mean, I echo the things that Caroline said, of course. They came up in our conversation as well, but the things that weren't mentioned that we talked about was access. It seems like globally access was a topic, and what we mean by that is transportation access to our more rural areas. And who, I know we talked about BCC's efforts. I know that Norma has talked about, they're working in collaboration with Toyota. CARTS is available, but CARTS is limited. We've talked about that. So, right. Access to, so medicine, but specifically because we have a representative for prescription medications, right? So medicine and prescription medication. And I know that Christy has gotten a coup in some of her prescription medications availability.
Thanks to Tessie sitting there with you. She does a big part of that.
Yeah, she's the one, right? And then also access. So we kicked around, Christy, having another day for the clinic. And I know that that is, I mean, I know that that's a challenge. And I know, I mean, it's not without some critical thought, I assure you. And it's not criticism, but just thinking, out loud how we.
For sure. And we're really wanting to do that. In fact, we just had this discussion moments ago. And
Saturday.
it's bridging the patients and providers with the funding. It's
Yeah,
the fund-
yeah. Like
is the missing
that
dot.
critical thought, I assure you.
So no, we're on that. We're going to figure it out.
Asking, I don't mean to cut off, but Katie Joe, my nurse practitioner at Dr. Batier's office, I gave her your number. She wanted to reach out and volunteer.
She is. She's going to come half a Friday a month.
Thank you.
Yes. Okay. I didn't.
That's
Sorry.
my nurse practitioner. I go to her on a regular basis because of my illness, right? And I went to her a few weeks ago and I asked her to start to join my new health coalition. I'm gonna reach out to everybody in the room about this, right? And so while we're at my appointment, I talked to her about joining my health coalition. She knows that I was newly doula trained certified, and I'm a community health worker as well. She asked me, how could she help the community? I gave her your number. I got it from Cherie. And I did not tell you first that I was going to have her call, but she wanted to ask how she could provide some services here. So our health coalition meetings are going to be on the first Friday of the month because she's available to join them with me.
Beautiful.
And she said she wanted to come to Smithfield Community Clinic to volunteer some of her services. So that's what the connection I was trying to make.
Okay. Miss Katie Joe is, yes,
Okay.
Katie Joe. That's my name for her now. She is going to be coming a half a Friday a month, and she's volunteering. So that's huge. So I'd like to give her a hand just because.
So grateful. Okay, so the only other thing I had to talk about was the doula services and community health work. And that's going to be a huge part of the work that I do moving forward with Bastrop County Cares. And I came to this meeting tonight to support my executive director, of course, but I had no idea that these public health meetings were happening, and Jill invited me today. And I live in Smithfield. So although that I may be here under Bastrop County Cares, I'm here because I'm a resident. I'm here because this is my town, my city. This is where I raised my kids. I'm here because I'm a voice for my own community as well. And I have the lived experiences. I live a block away from the Smithfield Community Clinic. And I'm here again because I would like to see more of me, us, my community, my people, my friends, my colleagues in these meetings.
Mhm.
It's one thing for all of us to sit around and talk about the needs and what we see and what we know, but I can flip that hat easily. I can wear my Bastrop County Cares hat, or I can put on my Smithfield wife, mother, community member hat. And that's the hat that I want to wear tonight because it's going to help me address what I want to address with Bastrop County Cares. And so Cherie and I, not official announcement, but she's going to chair with me. And then I also met a community health worker at heart who I've already just made another partnership under the table. But it's those experiences, it's these type of meetings,
Yes.
and it's the connections that we can make where we all have a connection. Like Katie Joe, she never replied to me that she reached out to you, but I take no credit for that. It's who you know and who you're with and your experiences and your sharing things that make these connections. So I'm passing the mic, but thank you.
Thank you.
Yeah, you had some
Immigration and water.
Very important.
Okay. One of the things that I mentioned was just the changes with the administration and potential immigration enforcement changes. And I know that we're part of a county with a significant Latino population, and part of that community, also some of those people are undocumented. And I know that in the previous administration, there's been a lot of impact on the community for people going to public spaces, accessing services, and significant fear for being in the public with immigration enforcement changes. And I know certain counties and city governments are adapting and creating plans and mitigation strategies for how they're protecting the other community members that might be affected by these measures. I haven't heard anything in this community or in the county, and I'm concerned about what might be the impact for fear and discrimination for specific community members, and how are we going to ensure people want to continue to access health services, will feel comfortable going to schools, will continue to be active members of the community with these changes. So that was one thing that we talked about and really felt like there could be a significant public health impact for a significant proportion of the community also.
So
Good
not,
job, Maddie.
yeah, yes.
Proud of you. It's very good.
My friend.
She needs to be everybody's.
Actually, today I was at the county jail, and that question came up, and our sheriff, he said that he's preparing the jails. He's just they have a space that they're gonna be ready to get more people there, and that was a little bit disheartening to hear. But again, like even in this community, how many Latinos you see here? I've gone there. I post I go to the places that they go. I talk to them, and even for, I'll give you an example with the weatherization program that we have here. I've had direct encounters with residents here that own the property, and they're afraid to submit their paperwork because they feel afraid that once their paperwork is out, they will be exposed, and possibly even get thrown out of the country. People that work here hard, people that own and pay taxes, and some of them actually pay social security numbers that they will never will be able to pay because they don't, the social security number is not their own. They're not residents legitimately. So there's a real fear in our community here and throughout Bastrop County that they don't feel, they're not represented. They don't feel represented, and they don't feel comfortable coming down because of those things, because they become targets. Like in a public meeting like we're now, that we're live streaming, they will not feel comfortable showing their face and then possibly becoming targets. And that's been my experience as an engagement coordinator. I've been trying to bring people in, but they don't feel comfortable. We have had conversations outside the official channels and everything, but even trying me helping them and saying like, we have money to help you. Your roof is about to fall off. Can you please submit the paperwork? And they don't want to because of that.
Get to legalization, because all you have to do is support and get them in the process of legalizing their citizenship here. So, and I mean, I work very closely with the shelter in Austin, Casa Marinella, okay? And they get a lot of people from Africa, a lot of people from South America that are refugees that come here. And to get them on the right path, they just don't leave them there to go fend for their own. They put them on the path of what they have to do. So if we have that, you can do that in your own community to get people on the track of where they need to go to be a legalized immigrant here and not feeling like they have to hide. So and most of the people here have a legitimate reason why they are here. You just have to get them on that path, but the longer we don't do that and help them, the worse it's going to be for them. Because if they are not in the system, if they're not doing the check-in with ICE, if they're not doing what they have to do, then they're going to be caught and they're going to be sent home. So this is something that as a community, if we're aware, we shouldn't just talk about it. We should actually put a community together to help that process for the people that want to be citizens of our country.
Great help will be the community health workers, right? And as long as we are recruiting and actively finding the people who can speak to this population, right? I mean, I couldn't show up I mean, for obvious reasons, but also I don't speak Spanish, but I think it's really attracting the right people to be able to do some of this work, right? I think that's part of our job.
So we are running a little over time, and I really appreciate everyone being here, and we can continue this conversation. But in order to capture the information that I need for the comprehensive plan, I really hope that you all will post your ideas. If this conversation sparked a few other things, certainly that topic we just covered wasn't something that kind of was on top of mind. So if that's something we can put in here for some of the issues that came up, please bring that together. The other thing I was hoping, I've got the health resources there. If you can think of any place, I mean, we've got a lot of great resources here. If there's anyone that you wanted to just write down on that health resources list so that we can make sure we pay attention to that as Smithville, as for our comprehensive plan, please do just post, take your sticky and poster something about the health resources there. I'd like to close out the meeting, and then of course anyone who wants to stay and talk some more, I'll be here for until about 8 o'clock. So, but if you can take those, put your ideas up, take your sticky notes, run around for the next 5 minutes. And y'all can kind of maybe, well, I don't know. Well, maybe you guys can talk first, and then we'll have you run around. We'll close it out that way if that works for everybody. Yeah. Yeah. No, it's just no. Somewhere. No. There's no difference. One got one set and one got the other. It's no difference. I just need to have I'm going to count the dots no matter what color they are. So, all right. Thank you all very much. Sorry.
Okay, so while you're working between your dots and your colored pieces of paper, just a couple of comments just to reflect on what I've been hearing. One of the things that I'm constantly talking to the county judge and the county commissioners about is that we have to have skin in the game. And what that means is that we have to have sustainable funding. Sustainable funding and the resources, human and financial, to do the job. And in many cases, we're all chasing a grant dollar. And when you're chasing grant dollars, you're spending your energy chasing the dollars rather than finding the opportunities to do service delivery. And I'm stating the obvious, obviously. But what I would say to Smithville, who I dearly love, is to think about what you consider your absolute core and find a way to sustain the core. What is absolutely essential? And all of you are going to say, well, there are just so much. And it is. But what can you not live without? And how do you leverage some of the great things that you have in a sustainable way so that you don't have to think about it for years to come, that it's automatically there for the community? And some of that might be around policy or a systems change approach. Some of it might be around how you leverage tax dollars and the very thing that you were saying, Janice, about how to leverage some money that's already there that could be sustained over time. But I would recommend that Smithville consider, how do you do that and then build year by year on those sustainable things you want to keep. Otherwise, we're all going to keep chasing grant dollars. Yeah. So just wanted to kind of say that out loud.
And I just wanted to add, that's exactly what I feel I do all the time, is seeing where the next grant's gonna come. But please, as you're making your plan and think about resources, think of Bastrop County Cares as a resource. We're supposed to serve the county, and we want to be in Smithville. We want to be your thinking partner, your whatever initiative you have. Please use us. We want to grow. We want people to get to know us. We're trying to build relationships. We're in February, we're going to go door knocking and talking to people at the housing authority, because when we come to the park, sometimes they're not coming out. They're like, we don't know who you are. What do you want? And so we learn from other communities that it is a dark knocking doors. So we'll be in February knocking doors, getting to know people, telling them, this is who we are. This is when we're going to be at the park. Tell us what you want. So please, we are here to help, and just let us know how we can support your communities. Yes. Yes, ma'am.
So, yeah, I love Bastrop County Cares, but total task force for community health workers right now, how many do you have total?
6? Do we have 6?
No, we need about, 25. We need a platoon. We need a
No.
lot.
We're trying to build, yes.
So you have 6.
That's our goal, is to invest in our community health workers.
Okay.
It's very much needed.
Okay, perfect.
And I think I found another friend here.
Miss Bruno. So I was sitting at the Community Health Workers Advisory Committee meeting this morning, and we're moving forward with being qualified to educate community health workers. So we could talk more about that offline.
So we're just going to wrap it up and stop the live stream, and y'all can talk and do whatever you want to. But please do make sure I get the information up and the little dots so we can prioritize. And I really appreciate all y'all for being here. Thank you all very much. Really appreciate you.
Thank you. I'll piggyback on that and thank each of you too, and for your input. Much appreciated.